Dr. Deborah Harrington, welcome to the program.
Thank you very much.
You've just returned from Gaza. You are an OBGYN, and you went to treat women and children, I guess. What did you see there? Why did you even go?
I went because I've been to Gaza many times. I've been going since 2016 as part of a teaching group. I've never been in a conflict. I've never been in these circumstances. And what I saw was in Aqsa, which is in the middle area, was a hospital that was overwhelmed. It was overwhelmed with numbers of inpatients. It was overwhelmed with emergencies, trauma cases coming in all the time, at a level that it simply wasn't set up to deal with. And it had swollen to massive numbers of patients, both inpatients, but also just displaced people. So there were thousands of people taking refuge in the areas around the hospital, in the hospital. Normally there are about 150 inpatients, and that had swelled, I think, while we were there, to about 600 to 700 inpatients, and then another 200 to 300 presenting through the emergency department every day.
So what did you notice most? Are they women, children, men, fighting age, fighters? Who are they?
So I was expecting in some ways that this was a war situation, and therefore I was sort of anticipating that there were going to be perhaps young men, or all sorts of casualties, across the whole spectrum of society. But actually what I overwhelmingly saw was children. And on one day, I was thinking, this is New Year's Day, and there was one moment where I just looked at my watch, and it was about 2 p.m, and we had mass casualties coming in. And in fact, it was from a school shelter where there had been bombardment and blast, and we had mass casualties coming in. And I looked around the resus room, which is where all the sickest patients are taken. And out of the 5 patients in the resus room, 4 of them were children. One with an injury, with a horrendous injury, a shrapnel injury to the brain, weren't going to survive. And then the other children with horrendous mix of, open fractures, partial amputations, open chest wounds, horrendous lacerations from shrapnel to the sort of chest and head, and burns. And that was every day, looking around the emergency department. My overwhelming impression was, why are there so many children here? There were so many children.
And why were there so many children here?
I don't know, other than the bombardment. We were obviously taking casualties from the area immediately around the hospital, and they were coming in because those areas were being targeted, were being bombarded, sniper fire, shelling, and that's what we were seeing. And alongside the horrendous casualties, there were many people that came in dead, and some of the scenes I never expected to see. I mean, I thought I was really well prepared for this. I had thought about what I might see, but that struck me and will live with me forever.
Can I ask you something? You asked your question, why do we see all this? Was there anybody to ask a question to? Were there Israeli soldiers around? Could you say, don't target around the hospital? Why are you targeting? Was there any dialogue on trying to keep a hospital and shelter safe?
Shelter safe. So no direct. I didn't see any soldiers. The team they were with, so MAP, were in direct contact to deconflict, the areas that we were in. So every day there was a check with the IDF about where was safe for us to travel in, if the hospital was safe, and then we had to be withdrawn on the last 2 days along with our MSF colleagues, and that was because the area suddenly became designated as a red zone, and that means that it is now an active area.
How do you know it was designated? Who told you?
So there are areas, blocks, literally numbered. And our security were in contact with the IDF, and they said, this is no longer deconflicted, this is now a red zone in the area around the hospital.
Okay, so when we asked the IDF, following a very detailed forensic investigation by CNN of some 20 hospitals over a period of 2 months of this war, They told us that they do not intentionally operate around there. They said they're not operating around Al-Aqsa, and that if they do, then it's been approved at the higher echelons. That's what the IDF told us when we aired this piece. So the next question is, was there any Hamas around? Could you identify anybody of them that you could say, what are you doing here, endangering us? Did you have any notion that they might be in the area?
We had absolutely no notion, and we humanitarians, we were there to work in a hospital alongside our colleagues, some of whom I knew already. There was certainly nobody I could identify. It's not impossible that there may have been people, but I didn't see anyone. There was no one wearing, army fatigues or anything.
Can I play for you a soundbite from an American senator who, when I asked about getting aid in, getting medicine in, and the whole deconfliction, which you've just talked about, this was his response just a couple of days ago to me.
If you look at the Israeli inspection proceedings, for example, we visited a warehouse, Christiane, that was full of items that were rejected. I'm talking about health kits for the delivery of babies. I'm talking about water filtration systems. I'm talking about water quality testing systems. These were rejected by the Israeli screening authorities, and when they say one item has to be rejected off the truck, they send the entire truck back, and these trucks sometimes wait up to 20 days to get in.
I see you nodding. Does that ring true?
So we had to enter in through the Rafah border. So we came in through Egypt, we flew into Cairo and then up through Sinai and across the Rafah border. And there must have been about 300 trucks waiting to go in. And we did see trucks that had obviously been turned back. And one that really sticks with me is that there was a truck, really large lorry full of babies' nappies or diapers. The pallets were all uneven because I presume that they'd been checked or something when they were going in the other direction. And when we asked...
They'd been sent back?
So they'd been sent back at the border. Yeah, that's right.
So these are children's diapers,
Yes.
nappies?
Yes.
What about, you're an OBGYN.
Yes.
There are terrible stories of women who are giving birth in the street, who, I think there's something like 180 women per day give birth. Apparently 15% of them, I think that's the number, are unlikely to do well.
Yes, that's correct.
Tell me, what is the situation today for women, pregnant women, and the babies they deliver?
There is no antenatal care for women, so women are not getting any care in their pregnancy. Every woman that I did see, I asked her when she was last seen, and it was October. They're not getting, anemia is a real problem in Gaza anyway. It's about 50% of people are anemic, even in non-war times. They'd had no supplements, and the women I saw were really severely anemic. Now, if you are anemic and you bleed at the time of your birth, you may die because you haven't got the reserves. Women, there's a thing called vulnerable women, and in humanitarian crises situations, women become especially vulnerable. And that means that they're more likely to miscarry, they're more likely to have stillbirths, they're more likely to deliver prematurely. There are women, in Al-Aqsa, for example, there was a woman who'd had no antenatal care, and in fact she'd arrived the day before I arrived, and the obstetricians, wanted to tell me all about this woman. And she'd arrived fitting, so she was having seizures as a result of a complication of pregnancy called eclampsia. So if you have untreated high blood pressure, it can go on to cause fits. And this woman arrived unconscious, having continuous seizures. She was treated. Her baby was delivered by caesarean section. It was on the neonatal unit. But that woman was then on the intensive care unit with a cerebral hemorrhage as a result of her seizures. And that's the sort of thing that's happening. And that is just one of thousands of stories. Many women can never even reach a hospital to give birth. And that's because they haven't got transport. There is no electricity. It's dangerous. They might be entering, a hospital that is surrounded by by conflict, by bombardment. It's not safe for them to move. They can't even call an ambulance because Wi-Fi, you don't have a mobile signal, so they can't summon care.
You've been to Gaza, as you said,
Yes,
many
I have.
times. The health system there has never been fabulous, but there are a lot of hospitals.
There are a lot of hospitals.
What is
and
the state now? Because we hear the whole health situation is collapsing.
So I think there has been a sort of systematic dismantling, really, of the healthcare system. It's almost like a kind of a fall, really, of, you know, one hospital falls after the other, and healthcare systems, healthcare facilities should be protected. They're there for everybody.
I want to play this soundbite because when you say should be protected, I talked to, you know, a former, you know, mega US commander who knows a bit about war and going after terrorists and civilians. This is what he said.
I have felt that the hospital should have been kept open, Al-Shifa in particular, but all of them, and treat the civilians in these hospitals. Control them, though, ensure that the tunnels underneath them, headquarters or whatever is being done in them, is not allowed and is eliminated. But again, they need to provide for the people, without question.
He's saying, whatever the case in war, you need to provide for the people. Do the people have anywhere to go?
They've got nowhere, and they're getting less and less.
How do you feel as a doctor? I mean, you're a professional, do no harm.
I just feel desperate. I also feel ashamed and shocked that we're doing this to fellow humans. You know, my as you say, I'm a doctor. My whole career, my whole reason for getting up in the morning is to, corny as it sounds, to go and help people, and actually they're not being, you know, the healthcare professionals, as excellent, as committed, as compassionate as they are not able to do that. They haven't got supplies. They're coping with numbers that their facilities are not set up to deal with. They're losing staff all the time. I mean, the obstetrician that spoke to me this morning said, you know, they have got people everywhere giving birth in the corridors and in the halls. They haven't got staff to deliver them. They haven't got capacity in theatre to do caesarean sections. You know, babies are going to be asphyxiated, are going to die as a result of not being able to deliver mothers in a timely manner. They also said their neonatal unit is full of infection. It's full of babies dying from infection. They just can't cope, and there isn't the capacity to deal with it because so many healthcare facilities have been dismantled.
What did you notice about hunger? Because just now, since you've been back, the UN has said officially that they are noticing absolute famine conditions for a significant portion of people there.
The sort of humanitarian aid, the humanitarian response is just inadequate. It is because of the situation. I visited a UN camp. As I said, it had 40,000 people in the camp in a 60,000 square metre, so just over a square metre per person. Around the outside of that, there was another 10 to 20,000 of temporary shelters that people were living in abject conditions. There was one toilet for 615 people. But people are going hungry, children particularly, communicable diseases such as diarrheal diseases because of sanitation, because there isn't adequate water. There's 94% less water going in than there was.
90% less water.
Absolutely.
Dr. Deborah Harrington, thank you.
Thank you very much.